Halton Police is at the forefront of mental health crisis intervention training because of exercises like this.
Tasha, how are you feeling today?
I feel fantastic, actually, man. I feel great.
So your mom called us.
Excuse me? Okay, sorry. I don't want to talk to you about her, okay?
Okay.
She drives me crazy.
Halton's police service requires all frontline officers to receive the mental health training. And these officers, dispatchers, and even paramedics have been in training throughout the week.
This is a tool to which the officers can utilize on a day-to-day basis when serving the community, ensuring the safety and well-being of Halton residents.
Halton continues to be the safest region for the past 13 years, and it's the calls for crisis intervention that have been dominating the dispatch hotline.
Even though the crime rate is, steady, and we're still responding to those very important calls, the calls for service related to social disorders, so to speak, like mental health and addictions, have actually increased. So the officers are busier in dealing with these calls on a more regular basis.
Part of the crisis intervention training involves officers working with actors and mental health professionals who model behaviors of mental illness, like someone who is experiencing mania in this workshop.
50-year-old female who's been kicking furniture and yelling and shouting. Her mom's called in police. She's left the apartment herself, and there's been no previous police history at this address before.
I don't. I'm so sick and tired of her beating my.
For anything? Do you have any medical conditions?
You're hilarious. Oh my God, that's the weirdest way. Why do guys ask questions? Like, would you ever go up
You
to a guy
just
that says,
seem
hey,
you seem very wound up. Is there?
I got a lot of things going on, and and I've been really in a moment. I'm trying to get my life back in line, and I'm here with my mom, not because I want to be, but because I have to. And she was kind enough to let me live here, but I have to work.
I think this would be a great coast call. What I would suggest you do though is something like this. Sometimes it takes a while for the reports to get through. I'd be sending over your report to the officer, the coast officer, but also call them and just let them know this lady's a priority, this is what the experience was, and they'll go out and see her first thing in the morning.
St. Joseph's Healthcare's Sarah Burtonshaw, who leads part of the training, says Halton Police has its own mental health unit where officers and mental health workers respond to calls together.
We have the Crisis Outreach and Support Team, which is COAST, which is where there's a plainclothes officer working with a mental health team.
So while officers learn how to de-escalate and understand symptoms of people in crisis, Burtonshaw says there is no correlation between crime and mental illness. In fact, she says people battling mental illness are more likely to be a victim of a crime.
We know statistically there was a study done back in 2005 that people who have mental health issues are likely to be victims of theft 131 times more often than somebody without a mental health issue. And sadly, they are 6 times more likely to be murdered than people who do not have a mental health issue.
For Halton News, I'm Natalie Stoberman.